Hey everyone, it's Dr. J and Seren. We just had a really cool experience. Seren had some complications to a medical procedure that we've been working on for about 6 months, and I'm excited. Everything's better. So, Seren, to the extent that you feel comfortable, like what led our paths to cross?
I think my uncle reached out to you.
Yeah, your uncle was worried about you and was like, hey, I just want to know if you can help my niece.
Yeah.
And then that led us to have a visit. But what happened before that made your health go wonky?
I had complications with the surgery.
And the surgery really impacted your hormones.
Yes.
So what was it that was impacted?
Everything.
Yeah, everything. Like weight gain, it was metabolism,
Yeah.
it was water, it was how you were processing thoughts, it was kidney function, it was literally just about everything.
Yeah.
And at the time, I don't think that there was a really clear medical pathway for you, right? Like there wasn't any real options that anybody was trying to do, was there?
Mm-mm.
And so I think they had you on 1 or 2 medicines. I can't remember. Or were you prescription free when you came in?
No, I think it was 2.
2 medicines. And I think the medical approach was, here, take this, and we'll see you whenever, right? Like there wasn't really like a plan or a structure or anything.
Yeah.
So you came from not exactly next door, like it was out of state to get here. We did the workup. I'm like, yeah, I think we can do some things, and we can need to cut to the chase. And like you're feeling a lot better.
Yeah.
So from the work, like when we started working together in March to now, would you say, are you 20% better? Are you 50%? Or
I'd say about close to 100, honestly.
yeah, so we've had just an amazing response. I took you to the special room. We did the infusions.
Yeah.
And then we did some nerve reboot therapy. We did some injection therapy. And then we did a bunch of, testing. Like we got the hormones assessed. We wanted to balance hormones. And then we were looking for the right nutrients. And the most important nutrients are the ones that you need. And I'm really proud of you because we outlined some stuff. And you are really faithful in taking it. And so it was really nice thing. We also, there was some, tell everybody just kind of funny thing. We have a little Apis drops that are really good for skin health, and they've really helped you. And I think you and mom were talking, you're like, I got to get me some more of those drops because when I run out, I'm not as clear as I'd like. Become your own advocate, reach out to your inner circle for help, never give up. I love the fact that when we put everything in balance, good things happen, and this is just a perfect example of this. And now we want to just help you on the pathway to get everything ordered, organized, orderly, you're eating clean, you're getting enough water, and I just think it's healthy for people to tell their story, but it's also encouraging for other people that have, an accidental effect to a surgery. I mean, it wasn't intentional or wasn't the design for the surgery to give you complications, but they also didn't know exactly how to build you back up. That's what we really focused on here.
Yeah.
Is it okay to share the story with other people?
Yeah.
All right, you guys. So Seren had a undesired side effect from a surgical procedure that really threw off hormones. We're putting everything back in place. We did infusions. We did the nerve reset therapy. She's literally almost 100% better than when we started in March. And now we just want to keep going. So Dr. West and Seren signing out at the clinic, and we'll see you guys on the next video.